The Ministry of Health is saddened to report 2 further deaths linked to COVID-19. The families of both people will be in the country's thoughts at this very difficult time, and we extend our sympathy to them. All families need time to grieve, and we ask that their privacy continues to be respected. New Zealand now has 4 deaths associated with COVID-19. As we have said previously, this can be a very serious disease, particularly for elderly people and also for those with underlying health conditions. What we can say about the 2 cases we are reporting on today is that both deaths have occurred in older individuals with underlying health conditions. Both can also be linked to existing COVID-19 clusters. The first individual is a man in his 80s who died at Wellington Public Hospital yesterday. This gentleman had a link to an established cluster. To allow his family more time to grieve, we will not be identifying that cluster today. We can say that he first became unwell on the 26th of March. He was admitted to Wellington Hospital on the 28th of March and has been there under care ever since. We are confident that his close contacts have all been traced and that there is no additional risk posed by this very sad death. The second individual is a man in his 70s who died at Burwood Hospital in Christchurch yesterday. As with the death we reported on yesterday, this gentleman was one of a group of 20 residents transferred from Rosewood Rest Home and Hospital to Burwood as part of the Canterbury District Health Board's cluster management process. These residents were relocated to a ward at Burwood to allow them to be managed in one location, but in isolation from each other. This gentleman was tested on the 9th of April and subsequently returned a positive result for COVID-19. Due to the underlying vulnerabilities of this group, we cannot rule out further serious illness or deaths within it. We acknowledge the anxiety New Zealanders may be feeling about today's news, both in the wider community and also for family and whānau grieving over these sad deaths. And because of the current level 4 alert, we also know it can be difficult for families to feel that they're part of their loved ones' final hours. On behalf of all New Zealanders, the Ministry wants to sincerely thank frontline health staff who are also providing patients with comfort and support during these times. Again, today's news reinforces the importance of our move to alert level 4 and the measures we are all taking to limit spread, break the chain of transmission and prevent deaths. We want you to know that our health system will continue to do everything it can to support the fight against COVID-19. I just want to give you an update on the numbers for today. So today there are 29 new cases of COVID-19 to report, made up of 20 new confirmed cases and 9 new probable cases. As I've mentioned, there have been 2 additional deaths to report for a total of 4. There are now 422 reported cases who have recovered from COVID-19, an increase of 49 on yesterday. And we continue to report more people recovered than new combined cases. So the total combined confirmed and probable cases in New Zealand is 1,312. Today there are 15 people in hospital. That includes 5 in ICU, 1 each in Wellington, Middlemore, Hawke's Bay, Dunedin and North Shore. One of these ICU patients in Dunedin is in a critical condition. For those cases we have information on, we are still seeing a clear but declining link to overseas travel at 40%, with ongoing links to confirmed cases within New Zealand, 46%, including those in clusters we already know about and community transmission at 2%. we are still investigating 11% of cases. In terms of testing, yesterday we carried out 3,061 tests, with a rolling 7-day average of 3,619, and our total tests to date of 58,746. I just want to say a few words about clusters, because we at the Ministry have a focus on clusters, and we know that there's significant public interest in our management of them. And as I've stated earlier, 3 of the 4 deaths to date are linked to clusters. There are 13 significant clusters across New Zealand as of today, and our 3 largest clusters remain Matamata with 70 cases, Bluff with 85, and Marist College with 85. Although we've given those names to those clusters, I just want to reiterate that we see cases across the country, and those names do not necessarily mean that those cases are all in those places. The new cluster is an aged residential care facility in Christchurch known as the George Manning. Additionally, 2 of our larger Auckland clusters, which we have not previously named, we can now provide some additional information about. They are already on our website, but the first is an outbreak in the community which has subsequently resulted in cases at a Spectrum daycare facility, providing daycare to individuals with an intellectual disability. And the second cluster is linked to a private party to celebrate an event in Auckland. There have been 35 cases linked to this cluster.